Well, I'll tell you what, I've got about 1 minute after, so let's go ahead and get started. Welcome everyone to the online information session for the USC College of Nursing. This is going to be an overview of our Nursing Informatics program. Before we get started, I do have a few housekeeping items that will help things run a little bit more smoothly. If you're not speaking, it is helpful if you mute your microphone or phone. This can help cut down either on static or on background noise. Sometimes we had, people calling in from work and, someone's on call or you hear an ambulance go by or something. So it is helpful if you mute if you're not speaking. Also, since we've got a couple of us on, it is helpful if you give your name when you ask a question. That way we can make sure we're addressing it to the right person. Also, this session is being recorded, and within the next day or two, I'll send you a copy of this recording. All right, so let's go ahead and get started. So this is the format of today's meeting. We've got a PowerPoint presentation that'll take roughly 30 minutes to get through. At the conclusion of the presentation, we'll open it up for general questions. This session is very informal, and you're certainly welcome to ask questions throughout the presentation. If you ask a question that's going to be addressed a little bit later in the presentation, we may ask you to put the question on hold briefly until we get to that slide. All right. Also, I just want to note here that we're very fortunate to have Dr. Ron Hughes, Director of the Nursing Informatics program, joining us today. Dr. Hughes will be discussing the logistics of the program and answering questions as we go throughout the session. So welcome, Dr. Hughes.
Well, thank you. Happy to be here.
Thank you. All right. All right. I think we've kind of already done this, but you can see you can participate either via chat or verbally. Since there's a fairly small group, I think we'll just do everything audibly, and hopefully that'll work for everyone. Okay, make sure I've got covering all my bases here. All right, and again, just do want to emphasize that this session is very informal, so feel free to ask questions at any point throughout the presentation. All right, so here's the agenda for today's session. Some of the topics are true across all graduate nursing programs, and some are specific to the USC College of Nursing. Again, this session is going to cover the details for the Nursing Informatics program. It actually has information about both certificate and MSN programs. And you'll see that we have NI abbreviated a couple places throughout the session. That's just the abbreviation for Nursing Informatics, so it's the same thing. Before we get into it, does anybody have any specific questions? And when we get to that portion of the presentation, I'll make sure we emphasize that and address your questions. So any specific questions before we get started?
No, not for me.
I do not.
Okay, great. Well, again, very informal, so feel free to speak up at any point throughout the presentation. And all right, let's go ahead and move on. All right, before we get into the meat of today's session, we did want to highlight that last week, the U.S. News and World Report named us the #1 graduate online nursing program, as well as the #1 online program for veterans. And this is the this is the 7th year that we've been in the top 10. So as you consider different programs, I think it's important for you to realize the kind of reputation that USC has. And, especially people like Lindsay still trying to figure out what she wants to do or where she wants to go. This might be something that hopefully weighs things in our favor. All right, so who should get an NI degree? At this point, I'm going to hand it off to Dr. Hughes, and she's going to kind of explain the logistics of the NI program.
Good afternoon. So what we're looking at are individuals who have a BSN, who are looking at advancing in informatics. And informatics really involves a lot of data and information within organizations, and using that to not only help improve care processes, but also improve patient outcomes. Are both of you familiar with what informatics entails?
Yes, I am.
Okay.
I'm a little bit, yes.
Well, what is it that you know about it now?
I know it deals a lot with the electronic health records. My job is going to, they're going to be moving to Epic. I know they deal a lot with that. I know they deal a lot with like workflows to help it easier for the nurses and the doctors on the floor.
Great. Well, it sounds like you both have a good working knowledge, so that's helpful. We're starting to see EHRs being used more in outpatient settings, particularly private provider offices. Although, as you know, the cost of an EHR is pretty high. So we see EHRs more so in hospitals than we do other settings. Hopefully that'll change in time. But that's been the major repository for data that we use within hospitals. So next slide. So what's included? There are 10 courses. 8 of the courses are in the College of Nursing. 2 of the courses are in collaboration with the College of Engineering and Computing Science. At the end of your classwork, there is a practicum, and that's where we hope that you can work with clinical partners. Sometimes you're able to do this where you work. Other times you need to do it with someone else who's willing to have you come there and volunteer. You have some hands-on experience with informatics. And of course, we are looking for a fall admission. Next slide.
Oh, this also just emphasizes for its. How is the certificate different than the MSN, Dr. Hughes?
Well, so the MSN takes, there's more coursework involved. I guess is the easiest way to say that. Now, definitely the practicum. And so with the certificate, you're looking at taking a few courses. Is the biggest difference between the two. My preference would be, and I try to encourage as many of those interested in the program as to go for the actual MSN.
Good. Thank you.
So the didactic is the actual coursework. And we have a slide coming up showing what those courses are. The clinicals are basically, again, that's the practicum experience where you're doing hands-on, you're working with somebody who works in informatics within an organization and trying to learn as much as you can. What's so great about this is that more often than not, we find that you can only learn so much from books and reading, that you really do need to get your hands on data and working with people who can guide you and help you through problem solving. And then Scott. So the courses themselves, as you will see, the nurse, anything that has NURS is taught out of the College of Nursing. And those courses overlap with other master's students with the College of Nursing, with the exception of NURS 777, that's the Nursing Informatics practicum. And then also NURS 775, which is the Foundation of Nursing Informatics. Those are the courses that only nursing informatics students. The ITech courses for project management and then health data systems, those are the 2 that we offer in collaboration with the College of Engineering and Computing Science.
We're going to transition to admissions requirements next, but before we do that, I wanted to give everyone a chance if they had any specific questions about the logistics of the program or the coursework or things like that. Does anybody have any questions?
I have one. So, and this is Delota. I hear some talk about something called SQL, and do we learn any of those type of tools you use when you're in nursing informatics?
You do, and that's the course, the ITech 770.
Okay, all righty.
SQL is a great way to interface with different platforms and databases that particularly are used within hospitals and with the EHR.
Okay, thank you.
Any other questions before we move on? Okay, well, while you're thinking of your questions, I see that Cynthia's iPhone has joined us. Can I ask who this is? Because I said earlier I'll be sharing a copy of this presentation with everyone. I want to make sure I send it to the appropriate person. So who is Cynthia's iPhone?
Yes, it's Cynthia Apson.
Cynthia Apson. Okay, thank you. And you weren't by chance the person who signed on just a minute ago as Jennifer, were you?
Nope, there's another
No, I'm not.
Jennifer. 2 people just signed on.
There's more people I didn't even see. Okay, great. And Jennifer, what's your last name?
Yuen. Yun.
Well, great. Well, welcome both of you.
Thank you.
Glad you could join us. And again, I'll be sending a copy, a recording of this within the next day or two. All right. Let's transition on to the admissions requirements. So to be eligible for our MSN programs, you have to have successfully completed your BSN degree. We prefer applicants who have an overall GPA of 3.0 or higher in all coursework. Special attention is going to be given to the courses required for your BSN degree. Specifically, we're going to look at a lot of the science courses. You must also have a current unencumbered license in the state where the clinical requirements will be satisfied. And it's also important to note here that some of the different state boards of nursing have recently started imposing restrictions for delivery of online courses to students inside their state from programs outside of their state. We're currently permitted to admit students from about 23 or 24 different states. If you're not sure if your state qualifies, you can certainly check our website. There's a list there, or feel free to ask me kind of towards the end, and I can give you specific details about that. All right, so what's the application process? So anyone who's interested in the program must submit an online application to the graduate school. The application must include a goal statement and a current copy of your CV or resume, as well as a copy of your nursing license. The goal statement will have a prompt which will describe the role that you should describe the role of the nurse practitioner program that you're applying for, and describe how the program fits in with your career goals. We need to receive copies of all transcripts from anywhere that you received college credit, whether it was in high school, undergraduate, graduate. We can use unofficial transcripts for the review process, but if you're admitted, we'll need official copies at that point. So this is one thing that sometimes trips people up. They'll think, oh, they just need my final transcript. Anywhere that you got college credit, even if it was 1 credit during the summer, a lab course or something you did, is what we're doing is we use those to calculate a cumulative GPA. You'll also need 3 recommendations from individuals who are masters or doctorally prepared in the healthcare field. When you complete the application, you'll list their names and contact information for these individuals, and then they'll receive an electronic email from us, and then the link to the recommendation form is online. They can complete that and submit that electronically, so you don't need to physically collect recommendations from anyone. As you can see there, GRE is not required, and the majority of these items can be uploaded with your application, and some of them are actually required. You'll have to upload them before you're able to submit your application. Please note that we have to have all the required documents, the transcripts, recommendations, resume, etc., before your application can be sent to the department for review. After you submit your application, you can log back in and see what items have arrived. Okay, I'll also say once your application is submitted, it'll take a day or two for the graduate school to process everything. At that point, I'll review it and I'll follow back up with you and let you know if you have any outstanding items or anything we're still waiting on. So what's the application deadline? As noted earlier, the Nursing Informatics program only admits students to start during the fall semester. We're currently accepting applications until March 15th. Fall classes will begin August 19th. Typically, applicants are admitted on a rolling basis. So, most of the time you should find out within a few weeks of everything being completed and forwarded to the department for review. I do encourage you to submit your application and all required materials prior to the deadline. Depending on when you submit them, sometimes if you wait to the deadline, it can take a week or more for all items to be processed, because that's when a lot of items get sent to the graduate school. Once everything gets processed, again, I'll review your application and let you know if you have any missing items. The earlier you submit your application, the more time you have to get any missing items submitted. If you wait till the last minute to submit your application, you may only have a day or two to get those remaining items in. So again, upload as much as you can with your application, but as soon as you are able, go ahead and submit your application. And then where do you send everything? Again, I encourage you to upload as much as you can with your application. Any official items that you're sending, for example, transcripts, those should be mailed to the address of the graduate school listed here. If your school is one that can send transcripts via email, they're certainly welcome to do it there through that email address. Also, once you submit your application, you won't be able to upload any items to it anymore. So you were encouraged to, once you submit your application, you could submit items through that grad app email address there. Okay, and then finally, again, I review all the applications that get submitted. I will let you know when everything is complete and gets sent to the department for review. We've included a couple links here that we thought would be helpful for you. The first is our Nursing Informatics website. Just kind of highlights the schedule of the program, list of courses you'll be taking, the projected schedule, costs, that sort of thing. The second link is to our FAQ page, which answers a lot of basic questions across all the master's programs. And then the final link there is to the graduate school application. All right. Dr. Hughes, do you have anything else to add before we move on to questions?
Well, I'm very excited that each of you have taken an interest in informatics. It really is an emerging field that there are more and more opportunities coming available each and every day. There's a lot to be done with it. So I'm excited that you're interested. And please, any questions you have.
Okay. Well, we've talked a lot. So now it's your turn to ask questions. I'm sure we haven't covered everything. And I know some of you are still trying to figure out if this is something you want to do. And some of you probably have more specific questions about our program. So now's your chance.
I want to know the PhD program for the nursing informatics. Can you give me more information? How to bridge from the grad to the PhD program?
Are you talking about a PhD in nursing informatics?
Yes.
Okay, at this time, we're not offering a PhD in informatics. We have a generalized PhD program in nursing.
So in general, they can focus on the more informatics?
Oh, definitely. There's plenty of opportunity, especially when you're doing a dissertation with the focus on informatics. There is really an incredible opportunity given the data that we've been able to partner with from our clinical partners and also some state partners. So that is possible, but it wouldn't be a PhD in nursing informatics. It would be a PhD in nursing, as we have it here.
Why I asked you, because I already have my master's degree in the computing and information science and the bachelor in the nursing. So that's why I want to know how can I apply for more advanced.
So we have a couple students who have actually received a master's degree in healthcare informatics, and they are basically doing a double major. So they're doing a master's in healthcare informatics and then a master's in nursing informatics. For our PhD program, we really do want folks to have a master's in nursing. So does that help?
Yes, so that means that I still need to go through the master. Thank you.
And so that you have a master's in nursing.
Thank you, Jen, for that question. Jonathan, thank you for joining us. I know you were a little late. Just to help ease your concern, I'll be sending a copy of this presentation to everyone. So anything that you missed previously, you'll get to see that. But now we're kind of to the question and answer session. So any questions you have, don't hesitate to ask.
Thank you very much. I'm Jonathan. I just got a quick break from my patients. I'm at work here, so I wanted to stop in and see how you guys are doing today.
Great, wonderful, Jonathan. Thank you for joining us.
Absolutely.
Well, we've got plenty of time set aside for questions. So any other questions?
So there is a part-time and full-time option. Is the part-time just one class every 8 weeks, or and then in full-time is just is it 2 classes every 8 weeks?
Dr.
Was in
you want to respond to that?
You can go ahead, Scott.
I think the preference is that students do, well, the typical schedule, as Dr. Hughes mentioned earlier, is 2 classes every 8-week or 7-week term, okay? And
That's the
that's certainly-
preference, okay.
Yeah, that's the
Okay.
preferred schedule.
Okay.
If you can't do that, we can work with you, but you know, you have to remember that some of the courses are sequential in nature. You know, you have to have the first 2 before you have the next 2, that sort of thing. Also, not every course is offered every semester. So if you do deviate from the schedule some, you may actually have a semester or 2 where there's no classes that you can take just based on what you've had or what you need. So, you know, based on that, we do encourage people to stick as closely to that schedule as possible. But we also understand life happens and, you know, sometimes things need to change.
What does the schedule for clinicals look like? Are they throughout the program or usually towards the end?
They're towards the end. They're actually in the last 2 semesters of the program.
And are the students supposed, oh, I see.
Can you guys see this?
Yes.
Okay, so this is the proposed schedule. So, you know what Deloitte just asked, here's the projected schedule. 2 classes the first 7 weeks, 2 classes the second 7 weeks, and then the same thing in spring, summer, and then your second fall, you'd have your practicum experience. Okay. If you did the part-time schedule, the 1 class every 7 weeks, you know, it'd take you a little bit longer, take you, I guess that's 24 plus another, so about 28 months. So,
And do the students need to reach out to the informatics department at their employer to connect with somebody to do clinicals with?
That's the best place to start. But we have had some students, and again, this is a trend that we're finding nationwide, where the employer doesn't want you to do your practical experience with them. So the sooner you reach out, the better. So at least that way you know.
Thank you.
and one thing I'll say about practicums in the clinical hours, we do encourage students to kind of find their preceptor themselves, because, you know, oftentimes students will already have contacts within their community and know someone who might be a good person to work under. If you need help, then we can certainly help you do that. But truthfully, most of the time students end up having the ins already. What other questions do people have?
Does the University of South Carolina College of Nursing have connections with any hospitals in the Carolinas as far as job opportunities are concerned?
We do. We have clinical partners throughout the state.
And I've even heard in the past that some of the partners will give preference to USC students, or some agencies have actually gone as far to say, you know, we've got 10 slots, 20 slots, whatever the magic number is, we're going to give them all to USC students just because we know the quality of student we get from them is going to be strong.
Fantastic.
Good.
And
What other-
actually, I will say that our clinical partners were instrumental in us helping to start this program because they recognize the need for nurses who are trained in informatics.
What other questions do people have? Well, I'll tell you what, while you're thinking of your additional question, here is our contact information. You know, don't hesitate to reach out to either Dr. Hughes or myself. We'd be happy to answer any questions that you have. Do you just want to put a reminder that the application deadline is March 1st, so you've got a little bit less than a month. But again, I do encourage you to get everything submitted prior to that March 1st date, just because, you know, the longer you or closer you get to that, it gives you a little bit less time if there's any remaining items you still need to submit. What other questions do people have? now's your chance. So take full advantage of it while you can.
And if you can't come up with them later, you're more than welcome to come up with them later.
Sure. All right. Any other questions before we log off here?
I do not. Thank you.
I don't. Thank you.
Thank you for joining us.
Thank you, Dr. Hughes and Mr. Ranges.
Oh, well, nice chatting with you all. Again, thank you for your participation. You will get a copy of this recording certainly by tomorrow afternoon. But again, thanks for your participation. If you have any questions, please do not hesitate to reach back out. Have a great afternoon.
All right, you do the same.
Thank you. Bye-bye.